Hello and welcome to Triage, timely conversations for healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hi, everyone. We hope you are well. Thanks for joining us for this episode of Triage. I'm Rebecca Schaefer, a partner in the healthcare practice group at K&L Gates and resident in the Research Triangle Park office, joined by my colleague, Marty Folliard, who I'll ask to introduce himself in just a moment. We came together today to discuss a project launched by the Advanced Research Projects Agency for Health, or ARPA-H, to protect digital healthcare infrastructure. And this is all in the context of a proliferation of cybersecurity attacks on healthcare institutions. But before we get into that, Marty, you want to introduce yourself?
Yeah, absolutely. Hi, everyone. My name is Marty Folliard. I am an associate in the healthcare practice group here at K&L Gates. Do a lot of work in the privacy space, particularly HIPAA privacy. And prior to that, I worked at a university as a privacy and compliance officer as well. So a number of years of experience in the privacy space. And, I saw an interesting article recently where ARPA-H is coming out with an initiative to help hospitals and other healthcare organizations bolster their cybersecurity initiatives. And when I first saw this one, when I saw ARPA, I was actually curious if that was related to DARPA, the entity way back in the 60s that did all those mind control experiments with the CIA. But I'm guessing that's not their history. But I'm not quite as clear on that. So Rebecca, I know you're familiar with their background and their mission. So could you walk us through what that is?
That's hilarious, Marty. Yes, glad to. Thank you. So yeah, it's probably helpful to start with a reminder of what ARPA-H is, right? It's a relatively new agency that was authorized under the Consolidated Appropriations Act of 2022. That was enacted in March of that year, and again, authorized the establishment of ARPA-H within HHS. And it was created to support the development of high-impact research to drive healthcare breakthroughs, and also deliver transformative solutions for healthcare industry stakeholders and patients. The agency's mission focuses on leveraging research advances for real-world impact. And this announcement that we're focused on today for digital health security, they're also calling the project DigiHeals, is a good example of ARPA-H's model to tackle specific real-world problems in a hopefully impactful, tangible way. On August 21st, ARPA-H solicited proposals for a new project aiming to use established and proven national security technologies and apply them to civilian health systems, clinical care facilities, and also even personal health devices to protect against the growing threat of cyber attacks. The agency announced it would accept proposals through September 7th. And a key goal of the project and a motivating reason for its announcement is the administration's concern for ensuring continuity of patient care following a cyber attack on a healthcare facility. For example, that might lock providers out of the EMR or take other key patient care systems offline. It's focused on adapting cutting-edge security protocols, vulnerability detection, and automatic patching solutions, hoping to keep up with a rapidly evolving threat actor environment. I'll also say that the continuity of care concern extends to making sure that providers crippled by a cyber attack are not subsequently forced to permanently shutter their doors due to the operational and financial impacts of the event. So, Marty, I think you've been tracking some of the news and developments in this arena. Is that right?
Yeah, absolutely, Rebecca. So one thing I saw recently was the Department of Health and Human Services issued a sobering report a little bit earlier this year recapping cybersecurity and healthcare for the year 2022. And, as you can probably guess, the total number of healthcare breaches have been consistently trending upward for the last decade. That's not really surprising given the role of technology, not only in healthcare, but just in our everyday lives generally. However, what I think is noteworthy is that the data shows that the number of breaches has really significantly intensified in recent years. Specifically, over the last 3 years, the number of data breaches has doubled, and breaches as a result of cyber attacks are a major driver of that. Ransomware in particular has become pervasive. Ransomware is a nasty form of cyber attack where the malware is designed to prevent a user or an organization from accessing their files. Then the attacker demands that the victim pay a ransom in order to restore their access. This, of course, can cause significant disruption for industries like healthcare that rely on digital technologies for essential business or clinical tasks, such as the electronic medical record for patient encounters or revenue cycle management solutions for things like submitting claims and sending bills. Interestingly, the report cites a 2022 survey that was conducted by a cybersecurity firm, Sophos, that indicated that 66% of healthcare organizations surveyed had experienced a ransomware attack. And I actually just saw in a survey earlier today by another cybersecurity firm that showed an even higher number for 2023. The surveys also showed that ransomware is extremely effective at causing havoc, with over 90% of those reporting an attack also reporting that the attack impacted the organization's ability to operate and caused a loss of revenue. Another thing to think about here is the cost to remediate, which could potentially be upwards of millions of dollars, depending on the scope and complexity of the breach. And we've seen this play out a few times this summer. St. Margaret's Health in Illinois is a prime example. Last month, that hospital closed down permanently, in part because of a ransomware attack that crippled the hospital's ability to submit claims to payers for an extended period of time, including to Medicare and Medicaid, which sent it into a devastating financial spiral. I saw a quote from the hospital's vice president that, to me, was very chilling. She said, "You're dead in the water. Nothing went out, no claims, nothing got entered. It took months and months and months." And that's also happening again this month, where several dozen facilities owned by Prospect Medical Holdings have come to a standstill due to a cybersecurity attack. I saw an article yesterday that the group claiming responsibility for that attack states they stole over 2 terabytes of data, including 500,000 social security numbers, passports, driver's license, medical information, and corporate documents, not just for patients, but also for their workforce, for their employees. As bad as all that is, there's potential also for a double whammy here when the federal government gets involved, such as the federal agency that enforces HIPAA, which is the Office for Civil Rights, as the HIPAA-regulated entities that experience these events could also be in for, the double whammy in terms of sanctions for noncompliance with the security rule.
Yeah, no, it's really unfortunate. And obviously, our sympathies are with the provider community grappling with these threat actors. And these regulatory obligations obviously have been there for a long time. But yeah, after you deal with the operational disruptions, the financial impacts, if your revenue cycle is disrupted, you may and likely do also have a breach. You're reporting to individuals into OCR that can spark an OCR investigation into your HIPAA security rule and other HIPAA compliance. And so some examples of settlements in the recent past in this space. One is OCR settled with Banner Health in February of this year for $1.25 million, and also implementation of a corrective action plan. This was to resolve a data breach resulting from a hacking incident affecting 2.8 million patients and alleged HIPAA security rule violations, again, identified through OCR following their follow-on investigation. The corrective action measures include doubling down on the security rule obligations to conduct a thorough risk analysis to determine vulnerabilities to electronic patient systems or otherwise, and to develop a risk management plan to address those vulnerabilities. Similarly, in July of last year, Oklahoma State University Center for Health Sciences paid $875,000 to OCR and agreed to implement corrective action to settle potential violations of the HIPAA privacy, security, and breach notification rules. And this was following an incident involving a hacker installing malware, Marty, like you were describing, that disclosed EPHI for almost 300,000 patients. And like the Banner Health settlement, the Oklahoma State Corrective Action Plan involves 2 years of monitoring by OCR. Obviously, this is all very challenging for the provider community and places, obviously, tremendous burden on them. But Marty, can you remind us what resources already exist, independent of this ARPA-H project, to help covered entity providers meet their HIPAA obligations, particularly security rule obligations, and help them try to prevent cyber attacks?
Yeah, absolutely. Thankfully, HHS does offer some helpful resources on its website for security rule compliance models. In particular, it points to the Security Toolkit application developed by the National Institute of Standards and Technology, or NIST, as well as a HIPAA security risk assessment tool that is developed jointly with the Office of National Coordinator for Health Information Technology, or ONC. And there's also, other helpful guidance on OCR's website as well as FAQs on the security role that providers and other covered entities can use to help them navigate this space. I think the takeaway there being that if you follow those standards to the letter, then you might at least be able to avoid the double whammy effect of sanctions from OCR coupled with the effects of the cyber attack itself.
No, that's really helpful, Marty. Thank you. I might also mention that providers can sign up for weekly vulnerability bulletins. These are issued by, it's a listserv, and they're issued by the Cybersecurity and Infrastructure Security Agency. And they provide a timely weekly summary of new vulnerabilities recorded by NIST and also the National Vulnerability Database in the past week. It's a great resource for your IT security departments that lists vulnerabilities scored by level of severity and provides a detailed technical description of the issue, as well as links to source and patch information. With that, and maybe it's a segue back to this ARPA-H initiative that was recently announced, I think we will be eagerly watching what comes out as a result of this RFP. ARPA-H is certainly hoping that by adapting and extending security and software assurance technologies through this project, that DigiHeals will play a role in addressing vulnerabilities in health systems. And I think we'll all stay tuned to see what project proposals are awarded and how their outcomes contribute to developing new innovations in digital security that are specific to healthcare. And in the end, hopefully, it will give providers new tools that ease burden and support cybersecurity protection. And so with that, we thank everybody for their time and listening today. And Marty, it was great to talk with you. Thank you.
Yeah, you as well. Thank you, Rebecca.
Thanks again for listening to Triage, timely conversations for healthcare professionals. New episodes are available for download through Apple Podcasts, Google Podcasts, and Spotify. By subscribing to Triage, you will receive timely notifications for each new episode. Also, if you have any topics you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.